Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Danielle Bress. Thank you so much for being here, Danielle.
Oh, thank you so much for having me.
Let's start by introducing yourself to the audience.
Oh, okay. Well, as you just said, my name is Danielle Bress. I am a home health nurse. I've been working in the home health field for about 19 years, which is like my entire tenure as a nurse, pretty much. And currently, I'm working in the quality role. So seeing a lot of interesting things that are happening now from that aspect.
Well, I would love to dive into that. Let's take a step back and tell the audience, how did you decide to become a nurse? What made you interested in home health?
Okay, so those are two very different stories. Originally, I was going to be a pediatrician.
Wow.
Yes, and up until my grandfather died, he was still waiting for that to happen. But the turning point was I had my grandparents were diabetic, and one winter, my grandmother, she went out to take the trash, she slipped, she fell, and she like split her knee wide open.
Oh my gosh.
It was crazy. She didn't even feel it, because it was like ice. But I got to stay home for like a week to take care of her and like give her insulin shots and things like that as like an 8-year-old. So like she told me I would be a very good nurse at that point, and that kind of changed the trajectory. I mean, for a while I still thought I was going to be a doctor, and then as I got older, I was like, well, that's expensive. So
yes, ma'am.
I changed my route, and I think I made the right decision. As far as home health, it was just honestly something I fell into about 6 months after graduating. I graduated, I was working on like a med-surg step-down tele unit, and I knew that being in a hospital for 12 hours a day was not what I wanted to do. And so I just kind of went and I was like, oh, I'm trying to get a part-time job and see how this goes. And I fell in love with it. And I was like, I don't ever need to go back to the hospital. I mean, I did because we're nurses and we work multiple jobs, but for the most part, I've been in home health since then.
So for people who may not know what home health nurses do, can you explain from a day-to-day practical, not necessarily the quality side yet, but what does a home health nurse do?
So the type of home health that I do is considered Medicare certified, right? So it has to be skilled. So we, as far as nurses, we go into the home and we have to provide some sort of skill that a layperson couldn't provide or needed the supervision of professional discipline. So wound care, medication teaching, disease process teaching, could be a variety of different things. We got clients who have an exacerbation of something and they've come home and now they need to get back on track. And so it's kind of that monitoring. It's considered short-term intermittent. So I'm in the home for 30 minutes to an hour, depending on what I'm doing. Could be a little bit more if it's like an admission visit. And then I'm moving on and seeing, about 6 or 7 other people in a day.
Oh, wow. So you have like a certain territory that you are responsible for?
Yes, usually you do have a territory, depending on where you live and how many people you have. It could depend on how wide that territory is, but that is usually how it's done.
Yeah, home health has changed so much over the years, and I don't know if it's the same from a nursing perspective as it is from a therapy perspective, but it used to be pay per visit, and then some companies do salary.
Yes.
And so it can be, a wide variety of how you structure your day. That's why when you said 6 or 7, I'm thinking, if each is an hour and then you got to drive to the next place, that can end up being a longer day.
It definitely can. So back when I was in the field, I worked for a company that was salary. And I think At that point, most companies were that. But now it has definitely changed to a lot more pay per visit than salary. So that's definitely changed over the time. When the bulk of my home health experience in the field, I was a admissions nurse. So my territory was a lot wider than most because I was only seeing about 3 clients a day, depending on how many days a week I was working. But for the case managers, their territories are usually kind of like a zip code, maybe 2. It gets tricky in those rural areas sometimes.
Yeah, absolutely. So what made you switch from bedside home health nursing, so to speak, to working in the quality space?
It was kind of a I don't know if it's a natural progression, but I was working in the field and doing my 3 starts a day, and the manager needed to be off. And so they asked me if I would fill in while she was off. And it just kind of started from there. I've always been a person who wanted to do things and wanted to know things. So, anytime something new would come up, I think while I was in the field, we had like subcutaneous IVIG. And so it's like, oh, who wants to learn this? I do. Like, I was always someone who wanted to learn something, go to some meeting, do something. So, they called on me to fill in for that manager, and then she eventually left, and I was kind of asked to apply for the position, and I kind of went from there.
Okay, so what is the position? Is that the position that you're in now?
No, the role I'm in now is considered a director of clinical operations. So I started with in the field. I've been a preceptor, then I came a clinical manager. I've been a director of a home health agency, and then kind of landed here. In all of my roles, I always fall on educating new people
Uh-huh.
and making sure that we're getting good documentation because it's so specific in home health, right? So that's always something that I've leaned towards. So the role that I'm in now is really something I've been kind of aspiring to get to like my entire home health career.
That's awesome.
Well,
Congratulations.
thank you.
So, what advice would you give someone else who was, a bedside provider
Mhm.
and they wanted to start doing something else? Maybe they want to go into quality. What advice would you give them on what steps that they could take?
Get involved. Be involved. I don't know how a lot of companies do it now. I work for a company that's always asking for volunteers, whether it's for a work group or to help, recreate a process or fine tune something. Anytime those opportunities come up, get involved. This is number one, that kind of gets your name out there. People start to notice you and they call on you for more. And then you can kind of see if this is something that you want to do. It's a different world from being at the bedside or being in the car going from client to client. You really don't have, you're just responsible for yourself at that point, right? So when you're involved in these different projects, it allows you to see, like, do I want to play the game and be in meetings all day, and is this the way that I want to make a difference?
Yeah, and you know what I find, Danielle, is that sometimes, and I can't say I blame them, but sometimes clinicians want that extra experience,
Hmm.
but they don't want to do the project
Yeah.
without an extra bump in pay. Right.
Yes.
And sometimes I will say sometimes you have to do that in order to then get to the next step. And it's kind of a balance because you don't want to feel like a company is using all your talents and skills and you're not getting compensated for it.
Hmm.
And at the same time, there are skills that you need to build that will help you in whatever's next.
Absolutely. I was honestly just having this conversation with my director. But the workforce has changed so much, and some for good and some for bad. I feel like there is a work ethic that's missing a bit, and just kind of an enthusiasm, or even just I can think of the right word, just a passion for what you do,
Right.
right? So it's very muscle memory these days. I'm going to work, I'm getting my check, I'm going home. And I really hate that, especially in the healthcare space, because we're not there for, that's not the only thing we're there for. I'll say that. We're there to take care of people. So I struggle with that, and it's hard from this position because I try to find people who want to be involved.
Mm-hmm.
I have a few people that I pull on all the time, but I wish there were more, you know?
Yeah. So what do you think is contributing to that? Do you think it's, oh my gosh, I have so much student loans, so I have to think about the money.
Yeah, I think it's a few different things. I think we're seeing the effects of COVID, quite honestly, right? Of just a change in thought process.
Mm-hmm.
I want more balance, work-life balance, and what does that look like? And then we're also seeing the effects of the ridiculously rising cost of living everywhere.
Oh, yes.
Yeah.
Oh my gosh. I could think I'm gonna just probably share my age with this, or people will probably guess all. But it's like, you know how your parents used to say, I remember when, stuff was X amount of money. I remember when stamps were 25 cents and gas was
Yes.
less than $1. And I remember that because I'm an 80s baby. I was born in the 80s.
Yeah, me too.
And so the cost of living now for what you get now for what you pay for it is so drastically different.
So
It's like
much.
exponential. And like you said, that it kind of just took another jump during COVID.
hmm And a big jump. And it's not even just like the big cities anymore. I live in a small town. Well, it used to be a small town, but it's so much so that the big cities are pushing out to these like outer areas. And
Hmm.
even the cost of living there is crazy.
Yeah, same. I don't live in a big city either. And, you know, my husband and I are looking at houses, maybe to purchase within the year or so,
hmm
or within a year or two. And we're looking at the cost of the house for the square feet that you get.
Yeah,
And it's like, oh my gosh, that's
it's crazy.
it's crazy. You're not getting as much for your money.
I just bought my mom's house, because I was living in it. I just decided to buy it. It's a small house, 1,000 square feet. But if she would have actually sold it on the market, the amount she could have gotten for this was almost 300,000
Oh my
for
gosh.
this.
Yeah, and you're like for 1,000 square feet, right?
Yeah. Yeah.
Yeah. So so healthcare. I kind of got off track there. I was like, oh my
Sorry.
gosh. Thinking about cost of living, I can take me somewhere there.
Yeah.
But what do you think contributed to your transition the most when you transitioned from to doing? I know you said to get involved and to pick up projects and to raise your hand for things. But there anything else that helps you to stand out versus a colleague?
Um, well, I don't know how to say this. I'm just gonna be frank.
Please,
I
just
find
say it.
myself as a Black woman in kind of the corporate world.
Mm-hmm.
I am typically brought in to fix things.
Mm-hmm.
And I have a certain way about me. My mother was a drill sergeant, and not to say that I'm a drill sergeant, but and I've softened over the years. I'll say that, but I have a standard,
Right.
and there's a certain way that I like things to run and the way things to look. But I feel like I still feel like I'm close enough to the field to understand while also helping them understand the other world.
Mm-hmm.
And can be very transparent. So I think that's kind of like propelled me because I've come into like failing places and made things better and can use that to prove myself going forward.
Yeah, and that's a big deal because when you come into a new place, you have to be able to show that you can add value, right?
Yes.
So,
Yes.
the company has a problem and they need someone to help them solve the problem, and they don't know how to solve the problem, so they're expecting you to help them.
Yeah.
They don't even
Yeah.
know how to tell you how to help them. They just know that
They
there's
have
this
no idea. They have no idea. And it frustrates me often. I hate to, I'm not a job hopper. So, and mainly because there's about a year's time that I have to prove myself.
problem.
I'm finally to the age to where this is the age you should be in this kind of role. But for a long time, I was always the youngest person in the room.
Right.
Right. So it's like, what are you doing? You don't know what you don't know what you're doing. Like, and so that takes me about a year to prove myself. Like I do know what I'm doing and I can turn this around and your clinicians can trust you. Like you can have conversations. I feel like a lot of times like upper management is so secretive about things and they don't like having the hard conversations.
Hmm.
And in reality, people just want structure and openness. And usually you can kind of manage from there. You'll have one or two here or there, but they just want some structure and they just want you to tell them the truth.
Yeah, and I find that I tend to gravitate towards companies that are more transparent
Hmm.
than maybe I would have when I was younger. But I want a company that's going to be honest, good, bad, and indifferent with where the company is,
Right.
what you want me to do, how you see where this company is going. Just say the thing.
Yeah, just say it, and then I'll decide. And usually it's like, all right, well, this is where we are. What do I need to do?
Exactly, because then you can see how you can fit in to what the vision of the company is if you know what it is, if it's clearly laid out for you, versus if you're trying to guess and you kind of don't really know where you're going.
Yeah, for sure.
Hi, friends. I have found that when clinicians decide that it's time to leave the bedside, often it's like throwing darts at a board. They just want out and will take almost anything just to move into a non-clinical role. I have always recommended taking the time to really identify your strengths, passions, and skills, and what will fuel you so that your next role is your best role. I couldn't find a tool specifically for healthcare professionals that would provide the depth needed to get a really good career evaluation. Until now. I am so happy to recommend the Stream Ahead assessment created by Career Clinic. It's the profile that I wish I had created first. Stream Ahead is thorough, comprehensive, and frankly spot on. And yes, I have personally taken it myself. I'll share the link in the show notes section of this podcast. You can thank me later. So what do you think will help make healthcare safer for our patients and more sustainable for our colleagues?
In all aspects, better ratios, even for the clinicians that are in the field, their caseload sometimes can be super heavy. And, there's a shortage, or at least they say there's a shortage, especially of nurses. So figuring out new ways to get new employees. But also, I think anytime we're having conversations that affect client care, patient care, we need to make sure we have the right people in the room. And sometimes that's having some of the people that are actually doing the work in the room and really like valuing their input. We see a lot of people that make decisions from a business aspect. And my motto is you can't grow financially without growing in quality. You can't have one without the other. You may do for a while, with getting the money, but then your quality is going to suck. And the way that Medicare and the insurance companies work, it's pay for play. You got to have good quality to get good reimbursement. So instead of trying to figure out a way around that, let's figure out a way to actually have good quality.
Yeah, and I'm so glad you said that. Going back to the staffing ratios, I know that's a big topic now. And the experts have been talking about nursing shortage for years because there wasn't enough nurses coming out of school, and they knew the boomers were, going to be at the age where they'll need more healthcare, and there weren't going to be enough nurses to help. And then COVID pushed
Yeah.
more people out, of the healthcare industry. And so now we're seeing even more shortage of nurses and other healthcare professionals as well. And so how do companies create these better ratios so that clinical staff can provide the care that they want to provide,
Hmm.
pay them what is a fair, reasonable wage, and still meet their financial numbers?
Yeah. So I think some of them, I'll say, let's reassess what our financial numbers should be because
Yeah,
you know,
good point.
I I think they can be lower so that we can hit some of these other pieces, right? As a nurse, and especially a nurse in home health, and during the COVID times, it really frustrated me that we were considered needed. However, in home health, we are the lowest paid. We get paid less than the therapist,
I
but
did
we
not
have the
know that.
most. Yeah, we have the most responsibility when it comes to case management. If the nurse is on the case, they're the case manager automatically.
Wow, I didn't know
and
that.
I honestly thought that with COVID, I was going to see a little bit of shift in that, but I didn't. And I was really surprised in that because I was like, maybe they'll finally see that we're actually worth a little bit more than what they're paying us. So I really think that, looking at nursing pay, that needs to be reevaluated because that's a lot of responsibility on us, whether it's home health or anywhere else. I'm also seeing a lot of shifting to, and not saying that it's not appropriate because I know some great therapists who do great wound care, but a lot of the things that nurses are responsible for is kind of being shifted for, to therapist responsibility. And it comes from necessity because they don't have the nurses, but there's ways that we can get them. We At the company that I work for, we kind of have a resident program, or
Mhm.
not necessarily a resident, but for brand new nurses now. And I've come from the school of you need home health experience to come work in home health, but or at least a year experience somewhere. But they've adjusted to take new grads and kind of train them up that way. And I'm not really upset about that. I've seen some great progress from that program. And honestly, I'd probably take a new grad sometimes over a nurse who's been doing it for a while because they've developed some bad habits. Yes.
You don't have
And
to
those are hard to
untrain them.
yeah, those are hard to break sometimes. So just, thinking outside of the box on ways to get people interested in home health, but also really looking at the pay discrepancies between nursing and therapy.
That's interesting that you said that because I've never worked in home health. Most of my background has been in acute care. And I did know that nurses made less than therapists in the hospital setting,
Hmm.
or specifically in the bedside piece of that. And sometimes, even as you start to go into your early management, middle management roles, that a
Yeah.
person with a therapy degree made more than a nurse in the same role. But I
Yep.
did not know that carried over to home health as well.
It does. Yep. And the same with, the managers as well. Yeah.
And it's the reason why it just stands out to me is because from the therapist perspective, when we're looking for roles that are outside of the bedside, non-clinical roles, a
Hmm.
lot of these roles want a registered nurse, right? They don't even
Yes.
think that the therapist has, like, the therapist isn't even on their radar,
Yeah.
even though we have this skill set that can be used in those roles and we can excel in those roles. And I wonder, now that we're talking about it, I wonder if it's because of the pay difference.
That's a part of it. That's a part of it. I can say that the company that I work for has shifted that a lot. I've been with them for 5 years, and within that, probably within the last three, we're kind of evening out. At least in my division, we have about the same amount of rehab managers as we do clinical managers, and it works really well in my division. It doesn't work in every division, but I have a really heavy therapy, caseload. So just to have that insight inside the office is great. But there's a give and take within that, right? There's certain things that therapists can't do. There's certain things that nurses can't do with therapy. And so they trade off things. However, salary is not equal.
Right. I mean, we need diversity of thought. We need different types of practitioners in these roles because we're going to bring a different skill set. And
Yeah.
I agree with you that, if you and I have the same role, we're both director of clinical operations, as an example, or we're both directors of quality, we're expected to produce the same outcomes. So
Right.
therefore, the role should pay for the outcome.
Yep.
Right. And
Yeah.
so, yes, we bring a different skill set. One skill set's not better than the other skill set. It's just, can we produce the outcome? Right.
Yeah.
So, if that means that the nurse's pay goes up because it's the same role, then absolutely that should happen because we should be paid on the outcome, right?
Correct. Yes.
And so this is an interesting conversation, because I don't even know if some companies really think about the implications of some of those financial decisions that they're making.
Yeah. I don't think so. I've worked for a few different home health companies. So I can say some do and some don't like really consider it. But I haven't been a part of a real conversation like of why this is. Now I know that a lot of the therapists are doctors prepared, and So there's a difference in that. However, I always approach it from I've been in this field for 19 years and I have an associate's.
Right.
So, and I feel especially with home health, it's so niche. There's nothing. Now I am going back to school because I just feel like I should, but there's nothing that they're going to teach me in that class that's going to benefit really home health. That's my perspective of it because it's so different. I've gotten the leadership experience and things just from experience, but I'm not going to learn anything in that bachelor's class, that master's class that's going to, really improve what I'm doing in home health.
It's probably going to give you some context to the stuff that you've already been doing.
Yeah.
Right. Because it's like I tell people with certifications, when you get a certification, it should be, a lot of times it should be to validate what you know. Right? Because now you have the lingo. Now you can show that you're an expert in this particular thing. And so when you have the language and you have some real world context, that it makes what you learn on the academic side make more sense. And then you can put some things into practice or make some tweaks that you may not have otherwise made.
Yeah, I agree with that. So I think there's some. I mean, I've gotten in some interesting conversations over the years for people who don't know that I have an associate's. So that's always fun. But I honestly, I appreciate having an associate's only because I felt like even in the beginning of my nursing career, I had more skill set than some of the bachelor's prepared nurses because they were in class more. They were learning theory more. They were writing papers more. And we were on the floor, you know? So they all come into play, but I know there were a lot of nurses that I started out with that were scared to talk to people because they didn't really get that much experience doing that.
Yeah, it's so interesting you said that. I know we could have a whole conversation about this. But the soft skills and the people skills that used to be mandatory before you even got into your professional school. You had to volunteer. You had to show that you had this certain character and ability to work with people. Schools don't require that anymore.
Yep.
And we can see that play out in the workforce.
Absolutely.
And so it's just so interesting because, to your point, you can learn a lot of theory, but if you can't put it into practice, then, what good is it?
Yeah.
So, well, this has been a very interesting conversation. I'm glad that that we connected and we're able to talk through some of these things because you got my wheels spinning now, Danielle.
Well, we can, I can always come back and we can talk about something else.
hey, I'm here for it. Any parting words for the audience?
Well, if you're interested in home health or you just have more questions, because that is my passion, you can definitely reach out to me on LinkedIn and I'll answer whatever questions you have.
That's awesome. And I will link to Danielle's LinkedIn bio in the show notes so that you all can just click on it and find her on LinkedIn. And I'm glad that you said that, Danielle, because I do encourage people to start making genuine connections on LinkedIn. I think LinkedIn is an untapped platform and full of some golden nuggets. And no, this is not sponsored by LinkedIn. But I just have had a lot of success career-wise and meeting some wonderful people on LinkedIn. So I highly encourage it.
Yeah. And I'm fairly new. Like I've been on there, but I really haven't been active. So I'm trying to do better with that. So I would appreciate some push from people.
Yes. We help each other to stay on the platform when we connect. But thank you so much for being here, Danielle. I have really enjoyed our conversation and I appreciate your candor and honesty with the things that you shared today.
Absolutely. Thank you for having me, Brandy. It's been amazing.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.